Good afternoon, and thank you for joining us today in this fourth image live stream event from Retina Physician. My name is Mari Rodriguez, and I will be your host today. I'm a retina specialist in Worcester with Vitreoretinal Associates. I have no financial disclosures. As you know, our plan is to post an image challenge each month and then discuss the diagnosis and management using this platform. We would love to hear your thoughts online. You can find us on Facebook, LinkedIn, YouTube, and Twitter. You're also welcome to write on the chat and share your thoughts with us during the event. Today, we will be discussing a case that I saw last year. Cases like this are recognized more and more, and I think we are all seeing more of these patients in the retina community. This 57-year-old lady presented to our clinic with trouble reading, which had been progressively getting worse over the last few months. She was 20/20 on presentation with normal intraocular pressures. The anterior segment examination was positive for 1+ NS, but it was otherwise unremarkable. And then on the posterior segment exam, she had subtle macular pigmentary changes that could be seen here in this fundus photograph. However, these changes were more prominent in the fundus autofluorescence. So if we can go into the fundus autofluorescence image, here we saw some speckled hypoautofluorescent spots that were noted within the arcade. And then on OCT, she had multiple multifocal changes in the RPE as well as changes in the outer retina with some disruptions in the ellipsoid and the interdigitating zones. So there was one key part of the history that I intentionally withheld from this post, and it was that this patient had been taking pentosan polysulfate for interstitial cystitis for over 10 years. And as you know, pentosan polysulfate is currently the only FDA-approved medication, oral medication for the treatment of interstitial cystitis. There is growing evidence of a direct association between this therapy and the development of toxic maculopathy. Some papers have found a prevalence of about 15 to 23% toxicity in patients taking this medication, and there seems to be a dose-response relationship. So a recent study published in Ophthalmology Retina by Du et al. From the University of Wisconsin detected a 41% prevalence in their cross-sectional study, which is higher than the previously reported prevalence by others. OCT abnormalities demonstrated disruption in the IZ, EZ, and the RPE. And changes in the fundus autofluorescence showed hypoautofluorescence, hyperautofluorescence, and mixed appearance, mostly in the central subfield, but also at times extended beyond the arcades. And there were peripapillary abnormalities that were detected as well. In some patients even demonstrated a flying saucer sign, which sometimes is associated with hydroxychloroquine retinopathy. Now, going back to our patient, we asked her to discontinue her medication, and we have been watching her closely. Her symptoms and pigmentary changes persist, unfortunately, despite her being off this medication for over a year now. So in conclusion, I believe that surveillance for patients taking pentosan pyrosulfate should be performed on a regular basis, similar to what we do for patients on hydroxychloroquine and how we surveil for these patients. We should also do it for patients taking PPS. And so also despite discontinuation of pentosan polysulfate, the changes and symptoms can persist, and it is unclear whether they can progress. So again, thank you for tuning in today. You can leave us a comment online via our multiple platforms, and we hope to see you again in about a month as we discuss another interesting case. Thank you.